Hi, my name's Taylor Hayes and I'm a student paramedic at Monash. Today is the 12th of May 2013 and today I'll be measuring a radial pulse, a respiratory rate, palpitating and auscultating blood pressure, chest auscultation posterior and a Glasgow Coma Scale status. And this is my patient, Mr. Jones. Mr. Jones is 78 and he's here for an assessment today. So are you feeling well today, Mr. Jones?
Yeah, good, thank you.
That's good. Would I be able to take your radial pulse?
Yeah.
Yep. Have you ever had this taken
Yes.
before?
Yep.
Yep. So can I just have your wrist? Just relax. So I'm just going to put 2 fingers on his radial pulse, which is right next to his radius, and then I'm going to count for 30 seconds and to see how many beats, and then I'll times this score by 2. So just relax. Do you know what your normal...
I'm not really sure.
Not sure? No worries. Now, following this, for the remaining 30 seconds, I will count his respiratory rate. Now, what you have to do is make sure that you don't make the patient aware that you're counting their respiratory rate, as it may alter the way in which they're breathing, which will result in inaccurate results. So, yep. So just look at a piece of clothing or just his chest and count how many times he breathes in and out for 30 seconds, and then times this by 2 as well. Beautiful, thank you for that.
That's right.
Now, as you could see, I was a safe distance from him. I touched him softly, therefore not making him uncomfortable. I remained eye contact, I listened to his response, and maintained the calm and friendly tone. I'm now going to measure your pulse, your blood pressure. Have you ever had your blood pressure taken before, Mr. Jones?
Yes, I have.
Yep. So what I'm going to do is just put this on your arm. Now you're going to make sure that the arrow lines up with the brachial artery. Now it will tighten after a while, so it may be a little uncomfortable, but just bear with me and I'll do it as fast as I can. So you place the blood pressure cuff an inch above the elbow crease. Tighten this, and then I'll place my fingers on the brachial artery, which is here, and I'll be able to feel a pulse. When I feel a pulse, I pump, and once it disappears, I pump an extra 30, and then slowly release it by increments of 5. And when I start feeling the pulse come back again, that is the systolic blood pressure, which in this case is 115, which is within normal range. Are you feeling well today?
Yeah, fine.
Yep. It's feeling alright?
Yep.
That's good. Not in too much pain? Oh,
No.
I'll actually, while we're here, I'll measure your auscultating blood pressure. So I have to use a stethoscope for this one. Do you mind if I...
That's fine.
Beautiful. So what I'm going to do is just listen to it now, so then we can listen and find the diastolic blood pressure as well. So I'm just going to place the stethoscope on your brachial artery and pump away again. I know it's going to be uncomfortable, but I just ask you to bear with me again. So pump, so until I don't hear sounds, then I pump again for 30, then slowly release by increments of 5 again. Now when I start hearing sounds, that is the systolic blood pressure, and that's around 115 again. The sounds then will slowly vary, but you still continue to release it by increments of 5. Then when I stop hearing sounds, that is the diastolic blood pressure, which is around 80, which is very good. You're looking pretty well so far, which is a good sign. Do you exercise regularly?
Oh, I try to.
Try to? That's good. I'll just take this off you. Wasn't too painful?
No, it's all fine.
That's good. So as you can see, I'm talking to him, I'm listening to him. I was at his level, therefore making sure that he doesn't feel inferior. Eye contact, my soft sense of touch, not invading. And yep, so now I'm going to listen to your breathing. Have you ever had your breathing listened to before?
Yes, I have. Yep.
Yep. So I'm just
turn
going to, so just turn around. And is it alright if I lift your top up?
That's fine.
Thank you for that. Now just ask you, do you have any respiratory problems or breathing problems that you're aware of?
No.
Beautiful. Are you a smoker?
No.
Yep. So I just ask you to cough and lean forward a little. The cough removes any sputum in the lungs, which can cause irregular sounds, which we don't want. So I just ask you to breathe in and out normally, Mr. Jones. So I listen for 2 breaths at each point. So just breathe normally. Now what we're listening for is whether the left and the right lungs sound symmetrical, so whether the airflow in and out sounds even. We're listening to make sure that there's no wheezes or crackles. Usually wheezes are caused by asthma. Do you have asthma, Mr. Jones?
No.
That's good. So I'm not hearing much at the moment, which is very good. What you're listening for is, well, not hearing any crackles or wheezes. And the reason we go in a certain pattern is to listen to different areas of the lungs to ensure that they sound the same. Keep breathing normally, you're doing really well. And last 2 breaths. Very nice. Now I've asked the patient a bit about his history just to make sure that there's no current problems. I've asked him, I was down at his level, I've explained that I was going to touch him, I was sure to listen, made eye contact. There were pauses, which is another non-verbal technique, therefore the patient doesn't feel rushed and feels comfortable in the environment. I'm just now going to check your Glasgow Coma Scale score. So the patient has been following me with eye contact the whole time, therefore proving that he's alert, orientated, and no stimulus is required, or he hasn't been asked to look at me. So therefore he scores a 4. I'm now going to ask you a couple questions.
Yep.
So just answer them normally. So whereabouts are you today?
Just at the surgery.
Yep. And why have you come here today?
Just for a checkup.
Beautiful. And do you know what day it is today?
Sunday, May 12th.
Yep, so he's fully alert and orientated. He knows where he is, and therefore he gets a score for verbal of 5. I'm now just going to check your motor response. So what I want you to do is reach up and squeeze my fingers. So as you can see, the patient has reached up without any pain stimulus, so therefore his motor response is 6. And whilst asking him these questions, I've explained what I was going to do. I've gotten down on his level. I looked at him, I maintained eye contact the whole time. I listened, waited for him to speak, and paused. Therefore, the patient feels comfortable and aware of what's going on. Thank you. Therefore, the overall score is 15, sorry.